you are checking the joint mobilization, the joint range for the hip joint, like you can check the most of the range in a supine position, right? And then the only extension you can be done in the only extension can be done on the prone. But like you can check the external internal rotation in a prone position too, depending on your preference. But anyway, when somebody has the issue with the lower extremity, now you're gonna have your patient into the supine position, right? Mostly not like standing. Okay, so you're gonna check the unaffected side first, right? And then you need to think about what kind of range is the last for the affected side as usual when you're checking the other range. But basically, I'm gonna hold your legs, so don't try to do activate the motion. Sorry, that's it. So I want you to bring your leg all the way up to your chest area. Do you feel okay? And then you're gonna have it rest on the table. And then you're gonna bring your leg all the way out of the table. I'm gonna hold it here if it in case it's full. Do you feel okay? Okay. And then you're gonna bring this leg, cross your leg over the left leg like that. Do you feel okay? Or there's another way that you can do the adduction. If you feel like you need to check the adduction better, then you can have your patient to the other leg. Can you hold your leg like here? Then can you bring your right leg towards your left side? Okay. And then bring it back. Like that's another way that you can check the adduction. And when it comes to external and internal rotation, then you're gonna have your patient into this position. And now you're gonna bring your foot toward you. Okay? And then away from you. Feel okay? Yeah. And then now I want you to lie facing down so I can check the extension. Then can I get you to bring your leg this up? You feel okay? Okay. So you can check like full range like that way, right? So what you need to decide is that whether extension is a range that I need to check first or the last, right? Depending on that, you can have your patient other range first and then check the extension, or if the other range you have to go first, then you can have your patient in a prone position first to check the extension and then flip them over to check everything else. The other way that you can do is that you're gonna check the unaffected side first, right? So then you can check everything else, like in that it doesn't matter if spine or prone, right? And then after you check the extension of the one side, and you can check the extension of the affected side, right? If it can go first, and then you can turn over, right? To save time, so you don't need to flip them over back and forth, right? Like that order.
So for the lower extremity, normally we do palpation with the table too, right? We don't.
Yeah, like you know, when you have your patient in a standing position and they try to palpate, they are kind of sway too, right? So you try to avoid those kind of the matters. So maybe, and then especially when they are intense, so then you cannot really feel the muscle better, right? So if you have your patient in those positions, then their muscles is relaxed. So then you can feel better of it, right? So it's better to have your patient into spine or prone position wherever you're palpating. And then for the lower part, you need to palpate from even the back if possible, like if you get the consent from that. And then lower back should be included, especially for the hip joint area kind of the issue. And then with the consent, you're gonna palpate the whole glute muscle too, right? And then the side of the glute muscle, hold the muscle like inner thigh too, and then the whole way to the foot too, right? And then you can ask your patient to flip over to actually feel the anterior side of the full leg muscle. But depending on what your patient has, you may need to start from their front side